Atrial fibrillation is one of the more common cardiac arrhythmias that we see in the hospital. Before we talk about atrial fibrillation, let's talk about the normal heartbeat. You have a specialized group of cells in the right atria called the SA node. And so these cells are going to depolarize and generate an electrical signal that goes out into the muscle of the atria, both the right and left side, and also goes down a specialized, for lack of a better description, we'll call it a wire that connects the SA node to another specialized group of cells called the AV node. AV stands for atrioventricular node. And so what happens is that electrical signal propagates down to the AV node, and the AV node slows that electrical signal down and then releases it slowly. And then that signal goes down into the ventricles, and it depolarizes the ventricles, and the ventricles then squeeze. So this normally stays synchronized. We have the top part of the heart squeezes, then the bottom part of the heart squeezes. Top, bottom, atria, ventricle, atria, ventricle. So that's how things are supposed to happen. And so the right side of your heart is pumping blood through your lungs, whereas the left side of your heart is pumping blood to the rest of your body. So what happens with atrial fibrillation, instead of the SA node generating these electrical impulses in a regulated fashion, you have different areas basically all over the right atria that are just chaotically generating signals. And so that causes the atria to not really squeeze like it's supposed to. Just think of it as sitting up there just kind of spazzing out. And so the problem is every time the top part of the heart has a spaz attack, it's going to send a signal down, this wiring I told you down to the AV node. And so as a result, the ventricle is going to attempt to keep up with what's going on in the atria. Now, it can't do that, but it tries. And so what we see with atrial fibrillation is, in general, the top part of the heart, again, is just having a fit up here. And as the ventricle tries to keep up, it's going to cause your pulse rate to be too fast and irregular. So you can often tell if you're in atrial fibrillation just by feeling your pulse. If it's rapid and very irregular, there's a good chance that you're in atrial fibrillation. So, and again, this is happening on both sides of the heart. So the things that can go wrong when you have atrial fibrillation is, number one, it can put you into high output heart failure. The heart's just trying to beat too fast, can't possibly keep up, but your heart's just going too fast, and so again that can cause high output heart failure, which is a specific type of heart failure we'll talk more about later. But the other thing that can happen is if the top part of the heart is not really squeezing like it's supposed to. Well, what does blood do when it's not moving, when it's not circulating? Well, it's forming clots. And so one of the things that can happen with rapid atrial fibrillation is you can start forming little clots up in your atria. And sometimes those clots can get out of your heart and go anywhere, but one of the places you have to be particularly concerned about is a clot going to your noggin, and that can cause what's called an embolic stroke. So when we put you in the hospital of atrial fibrillation, our goals are, number one, control the heart rate, get it to calm down, and we do that by using different medications that slow down the AV node, so that not so many impulses are getting through there. And so the main medications we use are beta blockers and calcium channel blockers. We sometimes use an older drug called digoxin, and again, all those act to just slow down the impulse through the AV node. Now, the problem you can sometimes have is calcium channel blockers and beta blockers are also blood pressure medications. So sometimes you can really get yourself in a mess because your blood pressure just won't tolerate the calcium channel blocker or beta blocker. And so that's a situation where I will often use digoxin, and sometimes we actually have to cardiovert. We can shock your heart back into a rhythm, but prefer not to do that unless we just have to. So the other thing that we have to do is we have to be cognizant that we might have an issue with clots in the heart. So the other thing we do is we put you on blood thinners. Now, oftentimes when people come into the emergency room, we have no idea how long you may have been in atrial fibrillation. If we know for sure that it's a recent onset, that is a situation where we might attempt to cardiovert you. In other words, put you back into a normal rhythm. But if we don't have a good idea of when you went into atrial fibrillation, it's not a good idea to try and put you back into a normal rhythm, again, because you might have a lot of clots floating around. And then if we suddenly make your atria start beating like it's supposed to, it's going to push those clots out. So restoring normal sinus rhythm is often not a goal during the initial encounter. Now, that may be a goal at a later date after you have been on blood thinners long enough to allow time for the clots to dissolve. But again, that's often a battle for another day. So again, when you come in, initial goals are control the heart rate and start anticoagulation. Restoration of a normal rhythm may or may not be a goal at a later date. So there is a similar arrhythmia called atrial flutter, which we actually treat it the exact same way that we treat atrial fibrillation. But the problem of atrial flutter is that the SA node is working like it's supposed to, and you don't have these chaotic sites outside the SA node generating those electrical impulses, but rather the SA node itself is just going too fast. And so you've got the top part of the heart just doing this. It can get really fast with atrial flutter. And just every time that the top part generates an electrical signal, again, same thing. It's overstimulating the AV node. The AV node tries to keep up with the top part, but it can't. But still, with atrial flutter, the complications can be the exact same. The heart's just going too fast, and you have to slow it down. Now, sometimes controlling the heart rate in atrial flutter can actually be more difficult than controlling the heart rate in atrial fibrillation. But again, at the end of the day, we treat the two conditions the same way. So this is atrial fibrillation and atrial flutter.